Lisa is sharing the screen, so shall we begin?
Yes.
Okay, thank you, Gemma. Thank you, everybody, for joining us. I'm Janet Weinstein, Director of Outreach with Lighthouse Guild, and with me is Lisa Miller, who's Outreach and Referral Coordinator with Lighthouse Guild. And we're very glad to be joining you today. It's been a while since we've connected with Stanley Isaacs, and certainly the first time during the pandemic and this whole new way of reaching people. But we're here today really to speak with you about aging and vision and living better with low vision, which is really what we're all about at Lighthouse Guild. So I'm going to give you an overview of the organization, some of the changes that happen to us as we get older in terms of our vision, the major conditions affecting older adults, and then some of the services that we have. So we are a leading nonprofit organization. I think many of you are probably familiar with us, but we're our goal, our dedication is to provide exceptional services to people who are visually impaired so that they can attain their goals. And we do this by providing coordinated care for eye health, vision rehabilitation, and behavioral health and related services. Just a little bit more on our services. We do have a broad range of vision and healthcare services for people of all ages, although the majority, about 2/3 of the people who need and receive services from us are older adults. And due to what's going on now, we continue to have direct services, both in people's homes, in the community, and at our headquarters on West 64th Street. But increasingly, we have telehealth services, which we'll be speaking with you more about. And we have national training and support programs also. That's just an overview, a little bit more later. First, what are the changes that we can expect in our vision as we get older? So quote unquote normal changes are, of course, by the time we're about 50 years old, most of us, even if we've never needed glasses, need glasses for reading. And that's because we lose what's called elasticity in our eyes. It's harder to adjust from seeing things far away to close up and close up to far away. That's an expected change that is usually resolved with reading glasses. Difficulty reading signs, seeing things in the distance. And need for more light. Our eyes don't allow as much light into them as we get older, and that's why often for older people have more trouble seeing at night. We also don't adjust as quickly from light to dark and dark to light. For example, if you go out in the middle of the day on a bright sunny day, you come into your apartment building, which has a dimly lit lobby, it may take a few minutes to adjust and to be able to see. And related to that are problems with contrast, being able to tell similar colors apart, like navy blue and black, or different shades of the same color, like shades of gray, which can be a safety hazard. When you go outside and you're on the sidewalk, it's a light gray. You're approaching the curb to cross the street. The road is a dark gray. If you had trouble with contrast, you might not see where the curb is to step down. In fact, undetected, untreated eye problems are the cause of a lot of falls, hip fractures, particularly in older adults, and problems with glare. Now, these, as I said, these can be expected parts of the aging process, but depending on how severe they are, they can also indicate more serious problems like glaucoma or diabetic eye disease or macular degeneration. And there's no way you can tell the difference. An eye doctor can. And we always emphasize the importance to have a professional eye exam where they dilate your eyes with the drops or do photography so that they can see what's going on in the back of your eye at least once a year. More often if you have a problem or the doctor notes that you're at risk of a problem, because that regular eye exam can tell you if you have eye diseases that can benefit from treatment to prevent vision loss. And speaking of eye diseases, the most common eye conditions in older adults are listed on this slide, and they are macular degeneration, diabetic eye disease, glaucoma, and cataracts when they're not treated. Also genetic disorders like retinitis pigmentosa and also albinism. When you have less pigment in your skin and your eyes, that also, people with albinism generally do have vision problems that cannot be fully corrected, and neurological field loss, most commonly related to stroke, hemanopia, which is the loss of half of your visual field, could be temporary or long-term. A little bit of detail about the top four. Age-related macular degeneration. It's the leading cause of vision loss in older adults. There are two types, wet and dry. And what happens with people, whether it's wet or dry, if you have a vision problem connected with, a vision loss connected with macular degeneration, things can look like they do in this slide of Lincoln Center, where it affects your central vision, your ability to see things straight ahead, also your ability to see fine detail. Print can look blurry or distorted. Now, with macular degeneration, most people have the dry type, which currently there is no effective medical or surgical treatment for that. The wet type, which previously resulted in greater vision loss, it's called wet because there's bleeding in the back of the eye, not the kind of bleeding you could see, but bleeding that if it's not stopped, it'll result in scars, and wherever that scar tissue is, you can have a blind spot like you're seeing on this slide here. Fortunately, there is medical treatment for the most severe form. You may have heard about that. The medical treatment most commonly used now are injections in the eye. That sounds a little scary, but the eye is numbed and no pain is involved, and the injections essentially stop the bleeding and prevent further damage to vision, and in some cases, vision actually improves. There's also a lot we know now about nutrition that could be helpful, and vitamins. Vitamin called lutein, Lutein, you may have heard about, that's in some vitamin supplements. And also, it's important. Lifestyle can be important. Smoking is a factor in developing macular degeneration, so don't smoke, or quit if you do smoke. Sun exposure, make sure that you're protected from the sun. Certain things are beyond our control. They're genetic. People with light skin and light eyes are more likely to develop macular degeneration, but there are, things that we can control about lifestyle that can help to either prevent or slow the progress of the condition. Next, diabetes. Now, this is an increasing factor in vision loss. It's actually now the leading cause of new cases of legal blindness in adults. And that is because of a condition called diabetic retinopathy, which most people with diabetes develop within 15 years of the onset of the condition. It affects people with type 1 and type 2. Now, what retinopathy does, again, it's bleeding in the eye, but it's not confined to one area. And it may not affect vision. It depends where in the eye it is. But if it's in an area of the eye that affects vision, again, if the bleeding isn't stopped, it can result in scarring. So this is the same scene that was in the previous slide of Lincoln Center, and you see splotches kind of throughout the visual field. And there's similar treatment to what I mentioned for macular degeneration that can stop the bleeding and prevent further damage. There are the other implications in terms of vision, besides having some blind spots. It can make you more glare sensitive. You can have problems with color vision and the greater need for light, which is occurring as a part of the aging process as well. So it can be exacerbated by diabetic eye disease. Now, part of the reason why diabetes is such a big factor is that type 2 is growing. Type 2 is the kind of diabetes where you can walk around for years not knowing that you have it. It's much more common in older people, and it's often triggered by lifestyle. It's important to keep your weight under control, be active, and eat a healthy diet. That can help to prevent diabetes, or if you have diabetes, it can help to keep you well and prevent complications such as vision loss. Now, the one thing I should mention is that these eye diseases are not unique. You can have more than one. And in fact, a lot of people who are diabetic also have glaucoma. Glaucoma is actually the leading cause of vision loss in African Americans and Hispanics, although it doesn't mean that others, Caucasians, I know several who have glaucoma. Glaucoma, what it is, it's increased pressure on the optic nerve, and it's damage to the optic nerve that sends messages from the eye up to the brain. And if it's not treated and it affects vision, it affects our side or peripheral vision. Same scene here as before on the slide, but you can see this is an example of somebody who has somewhat advanced glaucoma. They can see okay straight ahead, but their side vision is eradicated. Now, and that affects our ability to get around, to see if you're walking, say, on the street, it's your peripheral vision that'll tell you that there's something on the ground that you need to step over or around, even when you're looking straight ahead. If you didn't know that you had a vision problem, and you didn't know how to compensate for it, you could easily just not see what's there and trip and fall. In fact, people with glaucoma that's not treated, when I talked about people experiencing falls and hip fractures, it's even more common in people with undiagnosed, untreated glaucoma. And also contrast can be compromised even more in glaucoma than it would be normally as you get older. Now, most people with glaucoma will not develop serious vision loss because there are treatments, eye drops and some surgical treatments that can help to stop the damage. But once it's done, it's not reversible. So again, very, very important. That's always checked for when you go for an eye exam. You want to make sure the condition's caught early when it's most treatable. Cataracts, the last condition I'm going to go into in little detail, much different scenario. First of all, it's almost universal. If you live long enough, you're going to develop a cataract in one or both eyes. Not great news, but it has a good outcome. What cataracts are a clouding of the lens over the eye. So here we are with the same scene, and it's kind of blurry. In fact, that's not too advanced. It clouds vision, and also colors could be a little off. Things could look a little more yellow than they really are. The good news about cataracts is the treatment. People with cataracts, once they're advanced, if they're in, good enough physical health, there's the actual treatment for cataracts is an outpatient surgery that takes about 20 minutes. The doctor removes the damaged lens, replaces it with an artificial lens. And many, many people who've had cataract surgery will report having, and you may have the experience yourselves, even better vision than they had before they had the cataract. It's also very, very safe and very successful. It's one of the safest surgeries, not just of eyes, but about 99% successful. Thing is, you can have cataracts and have another condition also. So if you have the surgery, you may improve your vision, but still have issues connected with, say, your macular degeneration. But that's a very promising, scenario for people who do have cataracts, very different from decades ago. Next. Low vision, which is what we focus on. Just to be clear about what we mean, it sounds like such a general term. When we talk about low vision, we're talking about vision that cannot be corrected to normal with medication, surgery, or with regular eyeglasses or contact lenses. It's what's called a functional loss. It affects our ability to do what we need to do and like to do with the vision that we have, and in the daily activities that we do. And important to note, low vision can be a broad spectrum. It could be minimal vision loss that's not corrected, say that's impacting your ability to read, but also people who are legally blind can have low vision. It's a scary sounding term, but you can have significant vision and be considered legally blind. It just means that you have some severe limited vision. However, any vision, any degree of vision, low vision, is usable vision with the potential for rehabilitation. Lisa's going to be talking a little bit more about legal blindness and what it means in terms of coverage for the services that we have. Now, just to sum it up, low vision difficulties, what they may include would be recognizing a familiar face, reading print or doing other close work, perceiving contrast, and that, of course, can affect our ability to see obstacles like curbs and steps, and also the loss of peripheral or side vision. really any vision challenge that's impacting on your ability to do what you need or like to do can be addressed through vision rehabilitation services, which is a term, kind of an umbrella term for a lot of different services, all aimed at enabling people of all ages to make best use of whatever vision they have. And a large part of that is helping people adjust to low vision or blindness, especially when it's a condition that's age related and you've had normal vision through most of your life. And we help by introducing skills, strategies, and increasingly technology to maximize your function. The services we provide are customized, very individual, based on your personal needs. And the services, as I mentioned earlier, are provided in the home, in the community, and at our headquarters, depending on what the service is and what your preferences and what your goals are. Usually the first step in the process is a low vision examination. And that is a functional evaluation that's performed by a low vision doctor. This is an eye doctor who's gotten additional training in low vision. And I should point out that it's very different from a regular eye exam. And in fact, many of our low vision patients are referred by their regular eye doctor who recognizes that they've done everything they can with medicine, surgery, and glasses, but the person's still having problems. And a functional exam like this one can be helpful. So basically, the low vision doctor spends about 45 minutes to an hour with each patient, and they assess your overall function to help you make best use of your vision. They do that by going over with you, what are the visual cues that guide you through the day? Is it recognizing faces, getting around safely, seeing street signs, being able to manage your finances, and where are you having problems because of your vision loss? And that will include a contrast sensitivity test, which is actually shown in this slide for those of you who are on video. It's something that's not part of a regular eye exam, but it can be very, very critical in a low vision evaluation, because when you go to the regular eye doctor, and you see the numbers or the letters on the chart, those are like ideal conditions. Life isn't ideal. A lot of times there's lighting, there's lettering whether it's on paper or on a street sign that's not that vivid. So a contrast sensitivity test can really tell you a lot more than just the visual acuity or the visual field. And at the conclusion of the low vision exam, very often the low vision doctor will prescribe optical and other devices as well as technology. These might include high-powered glasses, magnifiers, electronic devices, increasingly are the case, field expanding, that's if you have peripheral vision loss, and non-optical illumination. And I should point out that we have an occupational therapist in our low vision center who can help to demonstrate, show you and demonstrate and train you in the use of devices and selection of the devices, as well as she can also work with you on developing alternative visual techniques. This is just a little bit more on the specific devices that are available to people, specifically to help people with vision loss. The electronic magnifiers are shown, both a large version and a pocket version. For people with severe vision loss, sometimes that's the only way they can access standard print, because it can blow the print up to about 60 times the size. It can also reverse it, like you see in the top left. If you have the slide, it's a portable, what's called a closed circuit TV, but it's a portable version where it's white print on a dark background, which is helpful for some people. Next. Okay, and other devices that are not optical can be really, really helpful, practical. Some of them are pretty simple, like lighting. Depending on your eye condition, we can recommend the types of lighting that could be helpful to you. A lap desk, signature guide, very simple thing that we can provide to you if you're having trouble seeing where to sign a document. That's also sometimes used to help people when they're reading. Bold print. We can connect you with talking books if that would be helpful to you. Insulin gauges for people who have diabetes. We can have talking instruments, and other devices that can just, like the little bottom right there is a little device called a Say When. It's something you stick on the edge of a cup if you're having trouble, say, pouring. you don't, and you're afraid of pouring hot water because you won't see when it reaches the top, and you might spill the water or burn yourself. This little device goes at the edge of the cup, and as the water approaches it, it makes a horrible noise. So, these are just a few of the examples of the solutions we can offer that can make a big difference in continuing activities. So to sum it up, the outcomes of the low vision, as I mentioned, we provide training in the use of prescribed devices. We encourage people to come with caregivers, family members, and others. First of all, so that they can better understand what you're going through with your eye condition and the impact of your eye condition on daily function. We recommend strategies to prevent injuries and loss of independence. Very important, and Lisa will get into that, is if you are legally blind, and a lot of times people don't know that coming into the exam because they can see, we can identify that and provide registration for you with the New York State Commission for the Blind if it's appropriate, which will cover the cost of some of the other services that we can provide to you. And we can refer you to other services that we provide, which Lisa is now going to speak about the other services. Lisa, unmute.
Got it, thanks. So some of the services start with low vision rehabilitation services. We have training programs. One of the training programs is our Independent Living Skills Training Program. And with the Independent Living Skills Training Program, it's part of all these services that are really here to help people regain functioning and maximize usable vision to remain safe and self-sufficient and active at any stage of their lives. These services are done at home and in the community and at the center. We are including independent living skills means that people would be trained in household tasks, for example, learn how to use the microwave with a plastic bump that shows you where the power button is and where the numbers are, and other such guidances so that people can get other such devices and help that helps people be able to really function as independently as possible, including orientation and mobility instruction. And for those of you that can see in the photo, there's someone learning to use her white sight cane, and this is a very lightweight white cane that allows people to scan the ground in front of them and to the sides of them in order to see if there are any obstacles through touch. And it really makes life a lot calmer for people that want to get around and can't see very well, so they know they won't bump into things or trip on things or step into a hole. Other low vision rehabilitation services that we have at Lighthouse Guild, we have academic skills training, preparing for higher education, our Adaptive Technology Center, which specializes in training people with computer modifications instruction, and career services, training and placement for people that are interested in returning to work. There are mass market devices for people with vision challenges, including those shown on the screen now, including readers, tablets, smartphones, and phones that can read to you. And many of these have technology accessibility functions that people can help with, even the companies can help with, and it's definitely something that makes a big difference in people's quality of life, is just being able to have access to these devices. We have health center services where Lighthouse Guild provides all the services and support to live fully and independently, including services such as primary care, internal medicine, behavioral health, which I'll talk a little bit more about, diabetes education, endocrinology, eye doctors, including vision rehabilitation, and podiatry, physical and occupational therapies. Those with diabetes, there's diabetes care for people with vision loss. That's very important because people with diabetes are at very high risk of losing vision. So there's diabetes self-management education with special emphasis on those who are blind or at risk of vision loss. and introduction of and instruction in use of adaptive medical equipment, such as a talking glucometer that reads out the blood sugars. In our behavioral health clinic, we provide services to help people in the adjustment to vision loss or in tolerating vision loss. There are normal and expected responses to vision loss, which include feelings of helplessness, boredom, anger, anxiety and fear, frustration, denial, sadness or depression. Lighthouse Guild's behavioral health services provide this care either in person or via telemental health, which means either phone or video call. And all our clinicians have expertise in caring for people with vision loss, traumatic brain injury, diabetes, and other chronic medical conditions. And it really helps to work with someone who's familiar with these issues and the resources available. We also offer in our behavioral health services individual therapy, couples therapy, family therapy. We have 3 psychiatrists providing psychiatric evaluations, psychopharmacology and medication management. We have group psychotherapy. We have a few groups coping with vision loss, and we have a Spanish healthcare group. Group psychotherapy, crisis intervention, social services, and telesupport groups for adults with low vision. We also have services for children and families, telesupport groups for parents and separate groups for their teens. The Lighthouse Guild Parent Support Network provides guidance for parents, youth and teen programs, including a Saturday program, and scholarships for students. Online, we have professional trainings offered to nurses, occupational therapists, social workers, case managers, medical students, optometrists, and ophthalmology residents. These are really geared towards the professionals, but of course there's some interesting information in there for people that are curious and good learners, want to find out a little bit more. So the online education provides continuing education for the credits for the professionals, and these are customized workshops and clinical trainings. So the big question for most people is when to seek services. Now, you may ask yourself these questions. You may ask your neighbors, your friends, your family, or even a stranger that you come upon that may seem to need some help. But just talking about yourself now, when is it time? On the left of the screen, you'll see one of our vision screening forms. When is it time to seek services at Lighthouse Guild? The question is, because of your vision, do you have difficulty reading the newspaper even while wearing glasses? Do you have difficulty moving around the house without bumping into things? Do you have difficulty cooking or using the stove? Difficulty identifying money or paying bills? Difficulty recognizing faces? Are you feeling sad, depressed, or anxious about your vision loss? If anyone answers yes to any of these questions, it's certainly worth a conversation to find out if there are supports that you might really benefit from that you haven't even thought of before. And another way of asking these questions is, do you have problems with daily activities due to vision challenges? Do you notice significant visual field loss, like in the images that Janet was describing, where peripheral vision narrows? Do you have difficulties with contrast, which is seeing the dark gray and the light gray when you step off the curb, or night vision? And has any of your doctors told you you have legal blindness? Coverage for services at Lighthouse Guild is primarily through Medicare and Medicaid and many insurance plans. We accept most insurance plans. And also, those who are legally blind may be eligible for sponsorship through the New York State Commission for the Blind. Excuse me. And for those that would qualify, I am actually the person that helps apply if that hasn't been done already. So there's a lot of support provided for those who need it. Lighthouse Guild is here to help people manage life with vision loss and to make the most of their lives. So here's our contact information. My number's right there. Lisa Miller, 212-769-7820. I'll also just mention my work cell. So if you dial me, I'll see your number come up just in case you forget to leave it. But please do leave your phone number on my voicemail. and share my number with anyone who you think might benefit from a conversation with me. I really appreciate being able to talk to people and let them know there are benefits, there are help, resources, there's a lot of help available for those who ask. And thank you for your attention to all this. I hope it was useful. Hope you can think of it useful for yourself or anyone in your neighborhood that all you have to do is let them know and it would help them. We open now to questions from everyone. If anybody has questions or comments, we welcome a discussion and we'd love to hear from you.
Yes. Thank you. Thank you, Lisa. Thank you, everybody. Any questions, comments, experiences you want to share?
Just a heads up, I muted a few people just to avoid any background noise, so feel free to unmute yourself.
Thanks, Gemma.
Mute. How can I find out how bad my no, how you call this, glaucoma? No, I don't have glaucoma. I have the cataracts. How do I know how bad my cataracts is?
Have you gone to your eye doctor recently?
Yeah, I went to a doctor and she says to me that I should wait. And then she was pregnant and now I had a new doctor and he says I need a cataracts done now. But not this what the other doctor was telling me. That is one question. The other question is, how can I get a good doctor in the event that I decided to do my cataracts? How can I get a good doctor to do the procedure on me?
Well, you go to an ophthalmologist, your eye doctor?
Yes.
Because most ophthalmologists do cataract surgery. So if you have an ophthalmologist you're comfortable with, you could certainly, use that doc or speak to that doctor. If they don't do it, they could refer you to somebody. That's number one. Number two, about whether you're ready for cataract surgery. There are a couple of things. A lot of that has to do with how much is the cataract affecting your functional vision, what we've been talking about, how advanced it is in terms of, are things really murky? Are you able to still use your vision for the things you need to use it for? Reading, writing, managing your finances, cooking, participating in watching TV, that kind of thing. If you're having significant difficulty, it's probably time to address, removal of the cataract. Now, the other thing you might want to consider, if you're not comfortable and the original doctor is still not back, getting a second opinion is always a good thing to do. And we don't recommend individual doctors, but do you live in the area of Stanley Isaacs?
Yes.
Because, Weill Cornell, we work with all the major medical centers, and, Weill Cornell is probably the closest, or Mount Sinai. Either one of those, if you contact their ophthalmology department, you could set up a consult, a second opinion with a doctor there, and at either of those places, they can, if the cataract surgery is appropriate and it's time to do it, they could arrange for that as well.
Okay. Thank you very much. Thank you.
You're very welcome.
I hope you don't mind. I had cataract surgery and I had a fantastic doctor, and I could recommend my doctor if you don't mind.
No,
okay.
You're well. Yeah, you could do that. If we can't do that, but you certainly can.
My doctor's name is Richard McCall.
Oh, yeah.
He's internationally well known. People come from 7 continents.
Yeah, he
was featured on PBS. He and his son, and he all the botched up cases they fix. So, but I go to him because I went to him because he was the best. Because I interviewed 3 doctors and he was the 3rd doctor. After I interviewed the 3 doctors, he was out of the 3. He was the only one that was able to do what I wanted him to do.
Do you have his phone number handy?
Yes. Give me yes, 1 second.
Yeah, I think he's in Queens, right? Long Island City or Astoria.
Yes. The good thing about him is that if for your surgery, if you live in Manhattan, they will pick up a private taxi cab from your house to to the place that you go to the center. So a round trip. So if you want your husband to go, you at the same spot, the same day, they'll pick you up, and then they'll take you back home as well.
Oh, that's great.
Yeah, you know, I think that's actually true of any cataract surgery. I think that's part of what's covered through Medicare.
No, the thing is that if my friends, some of them, they went to Mount Sinai or they went to a hospital, you have to provide your own transportation.
Oh,
But if
you do? Okay. I guess that, yeah, if it's a surgical center like that one, it's different.
because
Okay.
this is a surgical center, it's not in a hospital. So so that's what it is.
Okay.
And he does surgery, he does surgeries Tuesdays and Wednesdays, and he does anywhere from about 15 to 20 surgeries a week. So he's very well experienced, whether it's what you call it,
Cataracts?
complicated or whatever. So this is his number. Hold on.
Yes.
On my phone. 718
Yes.
718 728
Yes.
3400.
Yes. And his name is Richard McCord.
McCool, MACKOOL. It's a family run business. There's the son there, the senior, and the aunt is the administrator.
Okay.
Okay,
So, but
thank
they are
you.
good. Thank you so much.
Yeah, if you want, you can look on, you can Google Richard McCool on the web, on the your phone or your laptop, and you'll find the information, and you'll find the PB on the, so his website. You go Richard McCool, the Eye Institute. You'll find him. He's in Astoria.
Oh, perfect. Thank you so much.
You're welcome.
What is your name?
My name's Jane Lee.
Thank Jane. Thank you, Jane. I know you.
Okay,
Okay, thank you.
Thank you so much.
you're welcome.
Okay. Any other questions or comments?
No, that was, so the information was great. Thank you so much.
Oh, thank
Yes.
you. Thank you for being with us. Thank you, everybody.
Yeah, thank
Yeah,
you. It was
for the
great.
info. It was a great presentation.
Very informative.